And COVID spike, at least this time in New Delhi, is indicating that the numbers are as high as what we've seen 6 months ago. Remember, 6 months ago we were in a declining trajectory. Right now we are in an upswing. So, what are the COVID symptoms this time? Are they strikingly different from what they were last time? Is this just a flu, or we need to again mask up, pad up, and take care of the COVID precautions? Let's take this point forward with Dr. Prashant Chhajed, consultant, and he is part of the pulmonology department with Nanavati Max Super Speciality. Dr. Prashant, good morning. Thank you for joining us. I've never had a chance to interact with you in person, but so nice to have you on the show. The spike in the COVID numbers, sir, is that dangerous or this is manageable?
The spike that we are seeing in the COVID numbers is it seems to be linked to the variant of the Omicron. The symptoms are mild right now. Most of the individuals who are having the symptoms are having the symptoms dominantly for a couple of days. So the symptoms at the moment seem to be what we observe are mild. Of course, we need to continue our vigil and observation strongly for individuals, again, the high-risk individuals who are elderly, got comorbidities, have got underlying malignancy treatments going on, or are on immunosuppression therapy, etc.
How are the symptoms exactly different from the last, let's say, Omicron wave?
The symptoms that we have seen in the currently in the last couple of weeks are again the same: fever, sore throat, body ache. I had one patient again who had also the loss of taste was there. So the symptoms are the same as one had for COVID. What we are also seeing now, or have seen over the last few weeks, is a surge in the influenza wave. So we have been seeing a lot of patients with influenza and a few with H1N1 also. So there seems to be an overlap. Often there is a thought that yes, this could be a flu. So it is coming like a flu-like illness. It is almost similar, I would say, to the flu-like illness. So unless you actually test, you would not know whether this is a regular influenza or this is the COVID-19 at the moment. So the symptoms, Nikunj, are again the fever, sore throat, cough, running nose, body ache. These seems to be the common symptoms. Some of the patients do have a prolonged cough, which doesn't settle down as one would expect after a few days. So people are having a cough, which is prolonged for a couple of weeks. And individuals who have underlying lung problems, such as a bronchitis or an asthma or any other lung problem, seem to have more prolonged cough than other people.
Prashant, is it true that the cases are much higher within children, and especially the segment which was not vaccinated?
So, I mean, we are seeing a surge in children also. Again, I would say it is a mix of influenza. So, influenza at the moment seems to be coming more positive, seems to be coming more often positive than the H1N1. So, at the moment, I would say it is dominantly influenza and some cases of H1N1. I'm sorry, some cases of COVID, sorry.
Okay. Sure. Is it as contagious as the previous stages of COVID were, or is it a much milder strain, you think, Dr. Prashant?
This seems to be a milder strain. The symptoms are lasting for a very short time. Most of the individuals are responding well to just symptomatic therapy with just with paracetamol, for example. So it seems the symptoms overall seem to be milder.
Can this be managed at home, sir? Are there any cases where oxygen is dropping? Does that scary protocol start again?
So, most of the patients, I would say, are being managed at home. Symptoms are for a shorter duration of time. Individuals seem to be recovering quite, within a few days. However, a few individuals, again, as I would like to reiterate, are those who have comorbidities, who are undergoing cancer therapies, immunosuppression therapies. So we would have to identify these individuals or monitor them closely, and some of them would need hospitalization and maybe intravenous, antiviral therapies as per the protocol. So at the moment, the protocol in my practice and what my colleagues and me are practicing are just symptomatic therapy at home and keeping a close eye on those individuals who are at a risk of progression.
Final question, Dr. Prashant. Is it time to reconsider getting one more booster shot? Lot of folks have not gone to third. It had stopped at 2. Is it time to reconsider it?
Absolutely, absolutely. I think those who have not taken the booster shot should take the booster shot. I think
In the meantime,